The honourable member.
Madam Speaker, the Minister of Mental Health and Addictions has said that the government is meeting the moment when it comes to the toxic drug crisis. Over 42,000 Canadians have died. I can't see that as meeting the moment, Madam Speaker. Honestly, when I see that the government still doesn't have a plan, they still don't have a timeline on how they're going to tackle this issue. How many more people need to die before they declare a public health emergency? And Madam Speaker, I'll say this right now. The stigma starts right here. This government has spent less than 1% in responding to the toxic drug crisis than they did on COVID-19. Why?
The Honourable Minister of Mental Health and Addictions.
Thank you, Madam Chair, and I want to thank the member for his question and his compassionate and consistent relentless advocacy on what is a public health crisis. But, Madam Chair, we have put over $1 billion into addressing the overdose crisis in this country. We continue to invest through SUOP, through Budget 2024, the Emergency Treatment Fund, and also through $200 billion in bilateral agreements, of which over 30% on average across provinces and territories is going to mental health and substance use. We need to work with the health systems in the jurisdictions because this isn't a quick fix, it's a long game.
The honourable member.
That's not meeting the moment. That's not responding to a health emergency. We can look to Portugal on how they responded to a health emergency. They treated it as that. Madam Speaker, the federal government controls who and how supervised consumption services are provided. These services remain unavailable in most locations across the country, especially in more rural and remote locations. When will this government get rid of the red tape and ensure these services are available and funded nationally?
The Honourable Minister.
Thank you, Madam Chair. And can we do more? Yes, we can always do more, which is why we are making the investments that we're making at this time. But let me be clear, Madam Chair, the appropriate mechanism to address the ongoing overdose crisis is not the Emergencies Act. We cannot address it that way. It is pervasive. If it requires much longer-term sustained supports, it is not the right mechanism to save lives.
Member?
The member doesn't need to declare emergency then. Needs to act like it's an emergency. That's what we're looking for, Madam Speaker. That's what the moms and the families who've lost loved ones are looking for, or those that are struggling and the families that are impacted.